Let's talk about sunscreen, how to choose the right sunscreen, how to read a sunscreen label, and why a lot of the things that you hear on the internet are wrong. In other words, let's debunk some of those myths. My name is Dr. Blake Brooks. If you're new to this community, welcome. I'm a board-certified dermatologist and hair specialist, and on this channel, I talk about all things hair with some things skin and beauty thrown into. If that sounds like content you're interested in, please like this video, subscribe, and hit that notification bell so you don't miss any new content. I do put videos out on a regular basis, so if there's something you want to learn about, just let me know. So it's summer, it's hot, the sun is out, the UV index is high, so it's the perfect time to talk about sunscreen. As a dermatologist, I love sunscreen because every single day I see the effects of UV radiation on the skin. And yes, UV radiation might give you a summer glow you're after, and stay tuned because I'll talk about why that can be a dangerous goal. But it's also responsible for painful sunburns and, in the long run, skin aging and unwanted pigment and skin cancers. At a basic level, what do sunscreens do? Sunscreens protect your skin from the sun's ultraviolet rays, or UV radiation, with the idea being that in protecting from UV rays, the skin is protected from sunburn, aging, and skin cancer. So why should you use it? This is a let me count the ways question for me, but I'll choose two big ones. For one, to decrease your risk of skin cancers. I cut out skin cancers every single day. 1 in 5 people will get a skin cancer in their lifetime. That's high. A lot of times people think, well, most skin cancers aren't that big of a deal because I can cut them out. And for the majority of skin cancers, thankfully, that's true. It can just be treated with what's called an excision, but we shouldn't really say just an excision. There are a lot of spots on your body that are what I would call valuable real estate, right? Your scalp, your face, the back of your hands, your ears. And when we have to cut out skin cancers there, we do our best to give patients a good cosmetic outcome, but there is no such thing as a scarless surgery. And depending on how extensive that skin cancer is, it can be a suboptimal outcome. The other big reason, premature skin aging or sun-induced skin aging. Sunscreen is quite literally the best anti-aging tool you can use. It's thought that UV radiation is responsible for up to 80% of visible skin aging. Say that with me, 80%. Sun-induced skin aging leads to wrinkles, loss of skin elasticity, meaning it doesn't have that bounce back, it sags, pigmentation, sunspots, and little broken blood vessels. Is all UV radiation the same? No. UV radiation that we consider when considering the effects on the skin are UVA and UVB radiation. UVA is associated more with skin aging and tanning and also skin cancer. It can penetrate glass, which means it gets to you even when you are driving with the windows up. And it is present in ungodly high levels in tanning beds, way higher than what would happen with any natural sun exposure, which is why tanning beds are so dangerous. UVB is more linked to sunburns and certainly skin cancer development as well. It's important to understand this, as sunscreen can be really tricky and misleading if you don't know there are two different types of UV radiation and that we really want to protect against both. When do you need sunscreen? I generally wear sunscreen daily because it's part of my routine and I know it provides a lot of benefits, most if not all days. I see skin cancers all day, so that's a large part of my motivation, but from an aesthetics perspective, there are studies that show that daily use of facial sunscreen over 1 year improves clinical evaluation of photoaging or aging that occurs as a result of sun exposure. So again, sunscreen really is the best anti-aging tool we have. If you want to be more scientific about it, there is something called the UV index, which measures the strength of sunburn-producing UV radiation, some more UVB rays, and the UV index is measured for a particular place and time. If the UV index is low, while more related to UVB radiation, UVA radiation should also be lower. So larger health organizations note if the UV index is at 3 or above 3, sunscreen is recommended. So below 3, you could be a little less stringent with your sunscreen application. The UV index is pretty easy to find if you have a smartphone weather app. If you scroll down, it's usually near the bottom. How often do you need to reapply sunscreen? You should always reapply every 2 hours, and more often if in the water, because sunscreens become less effective with time and move on the skin as the body moves or gets rubbed off, creating an uneven layer that allows more UV radiation to penetrate. When we say every 2 hours, it's from time of application. So if you applied 20 minutes before you head outside, you have roughly 1.5 hours in the sun before you should be applying another layer. Doesn't sunscreen lead to dangerously low vitamin D levels? It's true that the sun allows us to make the vitamin D we need, but the evidence points towards sunscreen not having much of an impact on vitamin D production. But you can always take a vitamin D supplement if you discover your levels are low for any reason, and that's a very good and safe way to replete or replenish those levels. What about do-it-yourself sunscreens? Don't do it yourself. Sometimes people will say, hey, I've got 20% zinc oxide here in a diaper cream, so let's mix it with lotion and I'll be all set. Because the sunscreen says 20% zinc oxide, which kind of makes sense, except that cosmetic chemists are really smart, and they work on formulations that allow for appropriate dispersion of the protective ingredients. It's a really complicated process, and the formulations tend to be complicated too. So do-it-yourself sunscreens are just a formula for sunburns. Can I use sunscreen after it's expired? I would throw it out. There's no guarantee it's working after expiry date, and if you wear sunscreen as recommended, it's probably not going to expire before you use it up. You also don't want to store sunscreen in the heat because it can break down and you can lose the protection you think you're getting even before the expiry date. Aren't I safe if I get a base tan? There is no such thing as a base tan. I'm so sorry to disappoint, but it's true, and it's important to know because every time you tan, we know that there are mutations that occur in your skin cells. In terms of what causes skin cancer, it's those mutations or the accumulation of those mutations. So every time you tan, you are moving closer and closer towards the possibility of getting a skin cancer. And that's why that summer glow that you might be coveting, best obtained through spray tans, much better than outdoor exposure that ultimately is going to lead to an increased risk of skin cancer and honestly, poor aesthetic outcome in the long haul. What are the important things to look for on a sunscreen container? This is a big question I get in clinic. Looking at a large aisle full of sunscreens and trying to pick the right one can be really confusing. There's a lot of different factors, so I'm going to break it down for you. There are 2 things to look for on the front of your container and 2 general things to look for on the back. On the front, there is the SPF number and the presence or absence of a note that the product provides broad spectrum protection. On the back are the types of active sunscreens and then some components in the inactive ingredients that I'll talk to you about that are worth looking for. Let's start on the front. So the first thing that we're going to look for is SPF and number. SPF stands for Sun Protective Factor, and it's a measure of how well sunscreen protects your skin from UVB rays specifically, which again is the type of UV radiation that causes burning. The SPF number tells you how much UVB is allowed to reach your skin. So think of higher numbers as allowing less UVB radiation in and so offering more protection. Some people will talk about the SPF indicating how much time you can spend in the sun without getting sunburned. I really think this is misleading because solar intensity varies by location, time of day, so I would not recommend thinking of SPF as providing a time for safe sun exposure. In general, the recommendation from dermatologists is SPF 30 or greater because in studies, we know that SPF 30 protects the skin from 97% of UVB radiation. There is a thought that there are diminishing returns above that SPF number. So SPF 50, for instance, blocks about 98% of UVB radiation. Not a big difference in studies, but it can be useful to kind of flip the perspective here and instead say SPF 30 sunscreens allow 3.3% of harmful UV rays to your skin, whereas SPF 50 sunscreens allow 1.7% of rays. So essentially, SPF 50 halved the amount of harmful rays let in. That's actually a big win. And I always tell my patients that these numbers are based on how SPF was applied in studies, which is precise application of a predetermined amount of sunscreen, generally not how we apply sunscreen. So there is almost certainly a benefit in applying a higher number in that we are just not perfect applicators and likely aren't getting the benefit of SPF 30 we think we are. There was actually a paper that was published in a well-regarded dermatology journal noting we should be thinking about SPF protection differently and more in line with the latter way I described it. The other thing on the front of a sunscreen is the presence or absence of the words broad spectrum. This is really important because the SPF number refers to protection from UVB radiation only. The broad spectrum note means you have coverage from UVA radiation. So if that isn't there, don't buy it. So let's talk about the back of a sunscreen. On the back, you're going to see a section called active ingredients. There, you're going to see the main sunscreen ingredients that are providing UV protection. This is where you're going to look to see if you are dealing with a mineral or chemical sunscreen. Mineral sunscreens are zinc oxide and titanium dioxide only. Those are the only ones. Chemical sunscreens sound like chemicals and are everything else, like oxybenzone. I'm going to get into the difference between mineral and chemical sunscreens in a little bit, but this is where you're going to find this information. Below active ingredients, you're going to see a section called inactive ingredients. This is where you're going to find a few things. The first is the presence or absence of an ingredient called iron oxides. This is most often found in tinted sunscreens, and studies show it protects against the effects of visible light, which can worsen unwanted pigmentation from light exposure, like melasma, visible light being even indoor light. So this is the one I'm most often telling my patients to look for. Other things that might be found here would be the elegance factor, so presence of ingredients like ceramides or centella asiatica or niacinamide, for instance. I won't go into detail on those ingredients, it's kind of beyond the scope of this video, but those ingredients are elegant, can provide some additional benefit, and can be found here. Often they're advertised on the front of the bottle or box as well. What's the difference between chemical and mineral sunscreens? There are two broad categories of sunscreen, chemical and mineral. Chemical sunscreens absorb UV rays and convert them into heat. Mineral sunscreens create a physical barrier on the skin, and while they do reflect UV rays, they actually also absorb UV radiation and convert them into a negligible amount of heat, which is often kind of misunderstood. Mineral sunscreens tend to be a little bit thicker and work immediately, whereas chemical sunscreens tend to be a little less noticeable on the skin and can take up to 20 minutes to become effective. So planning application before sun exposure is important with chemical sunscreens. Chemical sunscreens used to be what was called less photostable, meaning they would break down readily on sun exposure. Newer formulations tend to be much more stable with sun exposure than in the past, but in theory they can degrade on sun exposure and become less effective. The bigger thing is that they are far more likely to be irritating to the skin of people who are sensitive. And this to me is the big difference between mineral and chemical sunscreens. Aren't chemical sunscreens dangerous? There are a few things that lead people on social media to say chemical sunscreens are dangerous. I personally believe they are safe, but let's break this down into a few questions that I get in my clinic. Are chemical sunscreens absorbed into the body? There is data to suggest that chemical UV filters are absorbed, but that does not mean they are harmful. We do not have data to suggest that the absorption at the level it's occurring in sunscreens is causing harm, but we do know that they prevent UV exposure, which is a known carcinogen, meaning we are protecting against a known true threat. Are chemical sunscreens hormone disruptors? The data backing this is largely based on in vitro, meaning in a lab with cells in a little dish, and animal studies. We know what happens in lab studies, and animal studies often does not translate to what we see in humans. And that's in part because when these chemicals are studied in a lab or in animals, the level of exposure is often thousands of times higher than what would typically be absorbed in humans with regular sunscreen application. There was a study where humans applied sunscreen all over their bodies and then hormone levels were measured with no biologically significant effect on hormone levels. Chemical sunscreens have been evaluated by regulatory bodies like the European Commission Scientific Committee on Consumer Safety, and after review of the data, the conclusion is that at the concentration used in sunscreens, the inclusion is okay and safe. Don't chemical sunscreens contain harmful carcinogens like benzene? Benzene is a known carcinogen, meaning it's been shown to cause cancer. The idea behind this is based on a study by Valisher. They bought around 300 sunscreens from 69 brands. They found benzene in 78, mostly spray sunscreens. To be clear, benzene is a trace contaminant. It's not specific to sunscreens, and it's not a sunscreen ingredient. It's actually been found as a contaminant in hand sanitizers and after sun products too. In the sunscreens where it was found as a contaminant, it was really specific to a product lot and a product. So even within the same brand, some products had contaminants and some didn't. We mostly are exposed to benzene by inhaling, things like cigarette smoke, plastic manufacturing, indoor air. Everyday life amounts are not enough to lead to cancer. It's more industrial workers who are working with benzene daily that have issues. The effective application to the skin is less well known, but we do know that most benzene evaporates quickly. Because of this, the amount absorbed is a fraction of a percent of what is in the product that is applied to the skin. Because benzene is so volatile and evaporates so readily, many scientists argue that almost none would be absorbed because it will all evaporate. Benzene in personal care products has never been linked to cancer, but UV exposure has. I'm not saying you shouldn't attempt to eliminate benzene exposure, and it's good that it's being investigated and worked on, but if you were wearing one of these products, you should not be overly worried, in my opinion. Are mineral sunscreens safer? The active ingredients in mineral sunscreens, zinc oxide and titanium dioxide, are the only two sunscreen ingredients the FDA has designated as generally recognized as safe and effective. So while I don't believe chemical sunscreens are unsafe, if you're still hesitant or uncomfortable after what I just went through, then stick with mineral sunscreens. You need to be comfortable with what you're putting on your skin and in your body, and mineral sunscreens will provide excellent protection. Are there special situations when one type of sunscreen is preferred? I personally believe that any sunscreen you're going to wear and like is a good sunscreen, but there are a few special situations when I tend to direct patients to mineral versus chemical sunscreens. So people with sensitive skin, including people with rosacea, I generally recommend mineral sunscreens as they're less likely to cause irritation. People with melasma, I generally recommend a broad spectrum tinted sunscreen so that it includes iron oxides and protects against darkening of melasma from visible light. Okay, I'm sure that there are things that I have not covered here that you might have questions about. Sunscreen's a very large topic, but hopefully that answers a lot of the questions that come up every day. If you have other questions, let me know below. I'll do my best to answer them. Remember, the sunscreen you like and that you'll wear is the best. And also remember that sunscreen is only a part of a sun protection regimen. Sun avoidance, especially during peak sun hours, which tends to be around 10 a.m. to 4 p.m., and protective clothing and accessories, think long sleeves, rash guards, and broad-rimmed hats, are all super important parts of a sun protective regimen. I look like a beekeeper when I go outside, so please join me, won't you? If you liked this video, please don't forget to like it and subscribe for more content. And thanks for watching. I'll see you next time.